Hello and welcome to another Pocket Physio video where we break down complex conditions so that you digital nomads can stay healthy and informed on the go. Today we are going to be talking about something called gluteal tendinopathy. We'll be breaking down what it is, what it feels like when you've got it, how long does it take to recover from, what are the best treatment options out there, and what can you start doing today to deal with this injury if you're experiencing it right now. So, yes, let's begin. So, what we're talking about today is, like I said, gluteal tendinopathy, which we like to say is a real pain in the butt. And that is because it is categorized by pain on the outside of the leg here. And it is primarily caused, if we're looking at the anatomy model here, by the tendons coming from the two glute muscles, the medius and the minimus. And we'll just bring them into view here. And this is why we see it's a real pain in the butt, because the pain is coming from those areas. So you can see the muscle coming along here at the back, and then this bigger muscle here coming down at the front, and they form this huge, very thick tendon. This model doesn't really do it justice. It's actually the thickest tendon in the human body. It's not the biggest tendon. We'll cover that in a later video, but it is the thickest. So there's a lot going on there. Its role is to really stabilize that hip in the joint. That's what those muscles do, and that's what that tendon does. You can see in there in the ball and socket. Its role is to stabilize that and assist in all those hip movements, lifting the leg up, out to the side, backwards, and everything like that. So why does it get hurt? Well, tendons are a very sensitive structure, and the main reason is usually repeated stress. So if you're maybe doing too much of a certain exercise, movement of activity over a short period of time, putting too much demand on the tendon, then that can really aggravate it and cause pain. And then also it can be caused, we'll bring it back into view here. Also, if you just fall on that side, you can see it is quite superficial. It's on the surface level. There's a few other things over the top of it, but on the surface level. So even just impact trauma to that region can cause it. Changes in the body is one of the big ones. Ladies, I'm talking to you. So yes, as you get older, as you hit the age of around 30, you're actually, as a female, your pelvis starts to change shape in order to make way for babies. This actually starts in your like 20s and stuff, and it actually changes the shape of the bone and forces the hip to come out at more of an angle like this, which just basically increases friction, can make it sore. And then actually when you head to later in life, in that more premenopausal stage, this area in particular actually starts to degenerate. So the tendon actually wears down, becomes less thick, is able to handle less, and then can then cause pain. You can also get elements of pain coming from swelling and inflammation, which more people would call like tendonitis. And again, that can happen for a number of reasons. So you can be getting it from that. So yes, there's quite a few reasons, and it's not exclusive to females. Males can still get it for all those same things that we discussed. But that's where it's most predominantly experienced. And yes, really, really intense pain that you'll feel right at the top of the hip. So if you were to basically go up the side of your leg and find that bony prominence sticking out, once you're there, you basically just slide your fingers up and press in. And if you move across the fibers, you'll actually feel the tendon right there. And if you do that and it's really sore, you know yours is a bit tender. Signs that you'll notice it, you'll feel that your hip is weak. You'll feel that you don't really have good control of the muscles. You'll also notice that when you lie on that side, it's really, really sore. When you lie on the opposite side, that also makes the other side really, really sore because your leg is pulling on the tendon. Equally, if you're sitting cross-legged for too long or with your legs in a basket for too long, again, you'll notice that a lot. And then, yeah, when you're trying to do a lot of hip movements, like trying to really climb the stairs or sitting in a chair normally for too long, that'll really aggravate the pain. So yes, the best treatment options, physiotherapy, and education are the best options for you. This is the type of thing that has a really varied symptom and recovery time. You could be looking at anywhere from 8 weeks to 18 months. Just really depends on the intensity and the severity of the case. In extreme cases, yeah, you could be looking at like up to 18 months. But physiotherapy is always recommended, always focused on education, pain modification, and exercises. Other things that you can do to manage the pain, shockwave therapy is becoming quite popular, which is a fairly expensive and painful procedure to go through, but it has been shown to really reduce the pain, particularly in the early stages. So if you do it at the beginning, it can be quite helpful, but we're yet to see any evidence of its impact in the long term. Another common thing that's done is steroid injections, but these are actually best avoided. What they do is they basically inject steroids directly into the tendon, which again, short term is good for pain, long term is not good though. And we see signs that it progresses the wear and tear and degenerative changes. So basically, you feel good for the first few months. A few years later, it's going to be way worse, and it's going to keep getting worse. So you want to avoid the steroid injections. By focusing on the exercise and the education, what you do see is just a gradual improvement over time, and that's always the best solution. So yes, pain management, patience, exercise modification, maybe some shockwave therapy if you need it. And then yeah, so that kind of gives us a good overview of everything that we need to know about this area. And again, the exercises are going to be a mixture of strength and mobility. It's important to hit both areas, and you're going to be looking at the hip itself, but then also you're going to look at some other areas around it, the lower back and the knee, just to make sure that everything is nice and strong and mobile and it can all support each other and work together. Now, I know what you're thinking, but Paul, what am I supposed to do right now? My hip is really, really sore. Well, I'm glad you asked, because what we're going to do now is we're going to jump over to Physi. Now, if you don't know Physi already, then I will quickly introduce. So Physi is Pocket Physio's own app that I created. It is to help me treat you guys. You know, it makes my job much easier, much more effective, and much more impactful. It helps me do my virtual consultations, prescribe exercises. You have access to Physi 24/7. You can ask questions. We can make modifications instantly. We can track your exercise routine. We can adjust your painkillers and pain management systems and all sorts. So it's a really, really useful tool. It's available to you 24/7 when you work with me and with Pocket Physio. So what we've done here is we've gone through a sort of trial initial assessment. I have pretended to be Linda. I am 45 and my left hip is really sore. Gone through all the things that we've just said here. You can see describing the pain, how it felt, feeling actually a bit inflamed and swollen, using some painkillers. These are my exercises. And then Physi has taken all that information and said gluteal tendinopathy. And then Physi has also explained why, which is really great, so that I can actually get that educational side of it and start to understand why the physiotherapist thinks that this is the pain that I'm experiencing, which is so important. And then I have asked, look here, you see, yes, please, can you create a simple rehab plan with 2 exercises? So let's see what Physi has to say. So we've got 1 glute bridge, and then we've been told how to perform it. Got some reps and sets, and then also clamshells. Again, how to perform reps and sets. And what Physi can also do is it can also search YouTube and find you an explanation video showing you how to do it at home. Super easy, or in the gym. You just have to ask. And then yes, I've also asked, so how can you help? What about the pain in general? What else can I do? So again, Physi has given some great advice: ice, painkiller, activity modification, sitting advice, heat therapy, some stretches. And then also here, how the session ends is to book a call with me, because that's what we do. Once you have this initial assessment, you jump on a call with me so that we can look over everything that Physi has said, make sure you understand it, and make sure you know what the plan is. So that is just a nice little snapshot and introduction there. So if this is you right now, why don't you give these exercises a go? Let me know if they help you in the comments below. So that pretty much sums up everything in today's video. Hope you enjoyed that, and if you did, please hit the like button and subscribe to the channel. It helps us support, helps us grow, helps us reach more people. And if this is you and you're in this situation and you're suffering from this hip pain, this real pain in the butt, then just click the link to start your treatment today, and I will see you guys in the next video.